Hello and welcome to the Nursing Leadership Conference of 2024. My name is Jennifer Espinosa and my topic will be on compassion fatigue. I have been a registered nurse for 15 years and have worked in several different patient care settings from the hospital to outpatient surgical centers. Currently, I work at the University of Miami's Bascom Palmer Eye Institute. So my topic being compassion fatigue is extremely important to me because I understand its detrimental effects not only on the nurse themselves, but for the patients and the unit as a whole. Compassion fatigue is a real issue within the nursing community, and light needs to be shed upon this topic so that other nurses and especially nurse managers are able to understand its effects and how to help nurses who are dealing with compassion fatigue. According to the Medicine Journal, compassion fatigue is the progressive and cumulative outcome of prolonged, continuous, and intense contact with patients, self-utilization, and exposure to multidimensional stress, leading to a compassion discomfort that exceeds a nurse's endurance levels. In short, this means that nurses are continually giving of themselves, but not investing any time to regain that energy. So, unfortunately, some of the effects that compassion fatigue can have on a nurse are negative effects physically, mentally, emotionally, spiritually, and intellectually. These effects not only affect the nurse themselves, but also the patients that they care for in a negative manner. Some nurses, consequently, who have compassion fatigue, consequently develop nurse burnout. And sadly, some nurses even leave the profession altogether. This is why the topic of compassion fatigue is so important to me, and the reason why I want to present this topic to you all. Nurse managers, nurse leadership needs to be ready to deal with compassion fatigue and to understand its effects on the nurse and the unit. Some signs of compassion fatigue are disengagement, poor morale, physical and emotional distress, absenteeism and tardiness, and high turnover rate. These issues affect the unit as a whole, especially the patients that the nurses are caring for. When these signs are evident in a nurse, the nurse manager needs to step in and help that nurse in any way possible. Some of the ways that a nurse manager can help a fellow nurse out, according to the Nurse Management Journal, is utilizing a timeout. Basically, a timeout is what it sounds like, a timeout for the nurse to step away from their job, their work, for a moment for themselves to regain their focus and regain their energy. For example, a situation where a nurse could use a timeout is after a very traumatic and stressful situation, such as a code or a patient death. Those are high stress situations that a regular human being needs to process. So therefore, a nurse definitely needs time out to regain their focus and regain their energy so that they're still able to care for the rest of the patients that they have for the day. Some other solutions that nurse managers could utilize is by promoting self-care activities. Self-care is extremely important in the life of a nurse, and they can utilize self-care activities not only during their day at work, but also on their days off. Some examples of self-care are physical exercising, walking, meditation, breath work, or even just spending time with their families. These are all very, very important for nurses to utilize on and off the unit to, again, combat compassion fatigue and regain their energy. So when they step back to their next shift, they're ready to take care of their patients in a positive way. Nursing leadership is extremely important in making not only their nurses important in making the workplace better for not only the nurses, but the patients and families as well. Nurse managers have a very important role in helping those nurses that are suffering from compassion fatigue by understanding the signs and symptoms, what to look out for, and how to help that nurse. By providing support and promoting strategies that help defend against compassion fatigue, nurse managers can change an entire culture on the nursing unit. When nurses have compassion while caring for their patients, they are better able to care for them and their families, which positively affects patient outcomes overall. So that concludes my presentation on compassion fatigue. Thank you all so very much for attending my presentation, and I hope that you all learned something that you can all take back to your own nursing units, or something that you can all utilize for yourselves to help prevent compassion fatigue. Thank you so much. And the nursing journal that I utilized for this topic was the Medicine Journal. The topic was detriments of compassion satisfaction, compassion fatigue, and burnout in nursing, a correlative meta-analysis. And the management journal that I utilized for this presentation was the Nursing Management Journal. And the title of this article was Conquering Compassion Fatigue, Lessons Learned for the Nurse Manager. Thank you all so very much, and have a great day.